Physician PC has grown to be one of the largest medical groups serving Western New York. And today we take a trip to ECMC. We would like to introduce you to Dr. Paul Patterson of their orthopedic surgery team. Dr. Patterson, how are you today?
I'm very well, thank you.
Well, General Physician PC continues to grow by the month, but your goal here is to make your patients comfortable, and that all starts with your core and your team.
I've always said that we have the best staff that you can possibly have. We're committed each and every patient to make sure that they have a good experience when they come here. We know that the patients who are coming to see us are in pain and they don't feel well, and our main consideration is to make sure every time they come here, they go away glad that they came.
So what exactly is carpal tunnel syndrome, and how do you know if you have it?
Carpal tunnel syndrome is the most common disorder of the hand as far as nerve problems go. And it's simply the result of a nerve at the level of your wrist not getting enough blood supply. And there's a little belt over the top of the wrist that gets thick as time goes along. It squeezes on the nerve, prevents the blood flow from getting to the nerve. And when that happens over and over and over again, it creates enough injury to the nerve itself that oftentimes the only way to make it better is to get a little more room for the nerve.
How are you diagnosed with this syndrome?
The most common way is really by your history and your physical exam. So patients who have a lot of pain at night, numbness and tingling, usually it's in the thumb, middle, index, and ring fingers of your hand, but it can go up towards your shoulder region. This is the device. It's, as you can see, it's very small in caliber. It's about half the size of most endoscopic implements. What we do is we use the ultrasound to make sure we know exactly where all the important parts are, the nerves, the blood vessels, and the tendons. We make a small incision just on this portion of the forearm. We then use the ultrasound to guide this into the canal, make sure that it's in exactly the right position. Once we make sure it's in exactly the right position, there's an added measure of safety in that we can deploy these two balloons that actually, we watch on ultrasound, you can actually see it push the vital structures away from the knife to make sure that when we pull the knife this way, I don't know if the camera can see that. You can see that there's a small knife that comes through, and it simply cuts that belt that's squeezing the nerve. When we start doing them in the office, it'll probably take about 2 hours of your time from the time you walk in until the time you're finished with your treatment. The actual procedure itself takes usually less than 5 minutes.
And just say you have carpal tunnel syndrome in both of your wrists, you can take care of it right here.
Yeah, the idea is this, is that it really does make treating both wrists at the same time very doable because you're really not hampered.
And it really is just a small incision that you can cover with a Band-Aid when you're finished.
Yes, I usually on the first day I'll put a big bulky bandage on it just to make sure everybody feels sorry for the patient, but after that they just wear a Band-Aid, and usually most discard the Band-Aid within about 3 or 4 days. For
the apprehensive patient, is it possible to take a sedative?
Yeah, what we can do is we can give you an oral sedative that you can take an hour or two beforehand, although I'll tell you that it's a very well tolerated procedure. Most patients are very surprised at how little discomfort there is with the procedure itself. It does decrease the recovery time by about in half, and then the other thing too is there's a lot less time mucking around, running around to doctor's offices, getting studies done and other things done when you could just be getting well and getting on your way.
All right, Dr. Patterson, thank you so much for joining us here today. Well, if you or a loved one struggle with carpal tunnel syndrome, make sure to visit Dr. Paul Patterson here at the General Physicians Orthopedics.